Hi, everyone. Good morning, good afternoon. My name is Danjuma Ada. I am the president of the World Hepatitis Alliance. On behalf of the over 350 million people living with hepatitis B or C, I'm honored to welcome you all to the third World Hepatitis Summit 2022, hosted by the World Hepatitis Alliance and co-sponsored by the World Health Organization. I congratulate the WHO for the leadership and the renewed GHSS 2022 to 2030 by member countries. The WHO has indeed renewed its goal of viral hepatitis elimination through the new GHSS. As we try for hepatitis elimination by 2030, we need commitments, investments, health systems which are inclusive of hepatitis, and innovative financing across the world. Looking back over the past 10 to 15 years, we have come a long way in the drive towards hepatitis elimination. Though countries have different levels of attainment of these goals, as a global community which has done more, and we must celebrate those milestones. Kudos to all, especially the WHO, WHA, the many committed countries and tireless advocates and many other key partners involved in moving the needle on viral hepatitis elimination. The last 2 to 3 years have been very challenging to the entire world. The foundation of humanity was shaken by a new virus, shaking healthcare systems, economies, taking human lives. Until date, we are yet to recover from the devastating effects of the COVID-19 pandemic. Many parts of the world are dealing with surging cases as we speak. However, the rapid response through heavy investments in research, funding, partnerships, behavior change campaigns with strategic leadership from the WHO, US CDC, and other partners yielded massive results in controlling the Hydra-headed monster, resulting in scientific breakthroughs in vaccine development and therapies. These breakthroughs happened quickly because there was an urgency, and importantly, because COVID was an issue that people cared about. Nelson Mandela said, I quote, "A fundamental concern for others in our individual and community lives will go a long way in making the world a better place we so passionately dreamt of." So the question is, do we care? Do we care about viral hepatitis? Do we care that viral hepatitis claims a life every 30 seconds? Do we care that liver cancer rates continue to rise with viral hepatitis being the main driver? Do we care that children are still born to hepatitis B despite a vaccine? Do we care that unless we change course, viral hepatitis is on course to take the lives of more than HIV, malaria, and TB combined by 2040? Unless the world cares, we will continue to lose over 1 million lives to viral hepatitis yearly. Yet, this doesn't have to be so. We have had the tools for years. We have diagnostics, vaccines, treatments, and even cures for hepatitis. And prices for all of these have come down, but are not yet accessible to all. Elimination is within our reach by 2030, yet there are many barriers, and we must dismantle them so these effective tools are available to all. We need people to care enough to remove those barriers. Countries are at different levels of elimination of viral hepatitis. Some are burdened by low investment, poor political will, inequalities, healthcare disparities, and stigma. We need people to care enough to fight those inequalities. We need people to care enough to put in those investments that will save lives and also save money long term. As I close, I ask again, who cares? At the World Hepatitis Alliance, we care. It's top of mind for us because we're living with viral hepatitis, and we represent the populations affected by viral hepatitis. We are the face of viral hepatitis. Hepatitis affects our health, our relationships, our career paths, our ability to support our family, our optimism, our mental health. It is a burden in our daily lives to our families, our partners, and impacts the future of our children and our posterity. I also care because I lost my mother to hepatitis C in 2007. I care because I live in a region and country with poor investment, weak healthcare systems to support hepatitis elimination. And without help, through a catalytic investment, the poor man in my village in Sakaka, who has no health insurance and has to walk like 4 kilometers to the nearest PHC and lives on less than $1 a day, cannot afford the cost out-of-pocket diagnostics or treatment for his hepatitis B or hepatitis C conditions. I care because I'm living with hepatitis B. And we have yet to find a cure for the virus that has potential to end my life. So yes, we care. And for the 350 million people living with hepatitis, We hope you do too. It is time to end the talk and walk our talk to action. I thank the WHA team, WHO, our speakers, our partners, and all who have cared enough to join us for this important meeting. Thank you and wish us all a happy and engaging World Hepatitis Summit. Thank you. So I will invite Sue Wang, the chairperson of the organizing committee. Thank you.
Hello, everybody. As program chair of the World Hepatitis Summit, our third one, I would like to welcome everyone here and remote and virtually to our third World Hepatitis Summit. What is the summit? This is an innovative, global, wide-scale meeting to advance the viral hepatitis agenda, and it is the only one focused on viral hepatitis elimination and a whole system response. It is a platform for us as a broad hepatitis community to take stock of progress to date, share ideas, experiences, learn from successes, challenges, exchange best practices, and drive that progress to make the elimination of viral hepatitis a reality by 2030. So who's here at the World Hepatitis Summit? What is so unique about our meeting is how diverse our delegates are. We include community members, country representatives, medical professionals, public health professionals, a mix of private and public sectors. I'm very excited that over the next 4 days, we will hear from global leaders in viral hepatitis, high-level country and government representatives, physicians, researchers, international agencies, funders, lots of civil society, and importantly, people living with viral hepatitis like me. This is a cross-sectorial and multidisciplinary meeting. It is a place for us as diverse stakeholders to forge stronger bonds. As past president of the World Hepatitis Alliance, I want to say that the Alliance is so proud to organize this summit with WHO co-sponsoring. The World Hepatitis Alliance is the global voice, as Danjuma mentioned, of 350 million people living with viral hepatitis, and we are currently a network of over 300 member organizations from over 100 countries. Our mission is to harness the power of people living with viral hepatitis in order to achieve its elimination. I want to acknowledge Charles Gore, sitting here at the end, who was the founder of the World Hepatitis Alliance 15 years ago. And we have to give him credit for the vision to create the World Hepatitis Summit back then. As a throwback, the first World Hepatitis Summit was in 2015, hosted by Scotland and Glasgow. We had 500 delegates from 84 countries and 46 governments represented. The second World Hepatitis Summit was in 2017 and was hosted by Brazil in Sao Paulo, and there were over 750 delegates from 106 countries. Much has happened since our first summit. We didn't have the global health sector strategy in 2015. In fact, the first World Hepatitis Summit facilitated the momentum for the historic GHSS in 2016, which solidified the target of hepatitis elimination by 2030. And as a response, the World Hepatitis Alliance launched the No Hep movement, which is the global movement to eliminate viral hepatitis by 2030. We all hope that you will join the No Hep movement. The original plan for our third World Hepatitis Summit was to have the summit in Thailand, but due to COVID, we had to pivot to a virtual meeting instead with a live stream from Geneva. But as we've learned, virtual events mean that we can have a wider reach and more people can participate, especially in a pandemic. Also, the platform for the summit will be up for 3 months, so you can catch all the sessions which are being recorded. But I do recommend trying to attend them live so you can benefit from the live interaction. Our theme this year is achieving the elimination of viral hepatitis within evolving health systems. We do have an exciting lineup over the next 4 days. Please look through the program and the platform to get the most out of this, because as the theme says, it is both a challenge and our opportunity. How do we make viral hepatitis a reality within the many health systems represented in the world? We have a web-based platform, which everybody online has joined, that is easy to navigate with a schedule, and you can select which sessions you want to attend. There are also many opportunities to interact with other attendees and speakers, so reach out to your colleagues around the world and connect via chat or even video. If you want to access the platform for the mobile device, there's an app which you should download. So today, after the opening ceremony, WHO will have a session that showcases the new GHSS. You will not want to miss that. We then have lightning talk session of the oral abstracts and 3 parallel parallel sessions. There'll be a symposium on stigma, which is not often seen in a lot of medical meetings. And we close with a celebration today of the Alliance's 15th anniversary. This is really a celebration of the hepatitis movement. It'll be a great chance to look at how far we've come with hepatitis elimination, so please stay with us for that as well. I need to thank everyone who has been a part of the planning and the organization of the summit. Thanks to the entire WHA staff, we are a very small but dedicated team, the WHO Global Hepatitis Program team, the World Hepatitis Summit Program Committee, and all the speakers, of which we have 200 speakers who will be here, and our more than 200 abstract submitters. It's been a long planning process with countless meetings, and it's great to see the fruit of it. We hope that in 2 years at our next summit, we will be back to full in-person capacity again. And don't miss our last session on Friday for the announcement about the fourth summit and which country will be hosting it. We look forward to hearing all the innovative work happening around the world, exchanging ideas, and having dynamic discussions. I know you all will be inspired by each other, and we hope this summit will invigorate all of us to accelerate our progress to elimination. 350 million people and their communities are counting on it. I want to pass this on to Meg Doherty, Dr. Meg Doherty, who is the director of WHO's HIV, STI, and Hepatitis Department. Her incredible leadership and support has elevated the viral hepatitis agenda, and we appreciate all that she's done to make this meeting successful. Dr. Doherty.
I think now my role is to stay here and stay put and have very short remarks. But thank you very much for all of you who have joined, especially the leadership of the World Hep Alliance, who has really brought us to this point, and where WHO has been walking with you in partnership since the very first days. And I want to thank you, because now I really start to see the fruit of all of this relationship and how we're seeing countries moving towards elimination. Just to mention that over the last day and a half, we had a pre-summit meeting where our ministries of health came forward and shared and showed how far they have come in terms of reaching the targets and goals towards elimination. And we hope in just a very few short years, we will have 1 or 2 countries ready for making those elimination targets. I want to also thank you that I'm taking on the helm from Gottfried Hörnschel, but also Andrew Ball, who's in the audience today, who is really leading and spearheading bringing hepatitis into the current department, where we've been able to learn from both the HIV field, the STI field now, to ensure that now as we take the mantle of new strategies, that we're really starting to envision the views and the mission of our DG, who will be speaking, of looking at primary care as a place to integrate services, of having a person-centered approach, and making sure that people are never left behind and the vulnerable are most focused on. So it's my deep pleasure, incredible pleasure, to be able to introduce our Director General, who comes off of a recent election for his second term. He is a champion of hepatitis. He has visited many of your countries, including Egypt, and I'm sure he'll be interested in going to many more countries in the future to see the progress that you've made. And we hope that we can continue to keep hepatitis as a flagship project within WHO as we move forward. So it is my pleasure now to introduce Dr. Tedros Adhanom Ghebreyesus for his opening remarks. Thank you, Dr. Tedros.
Thank you, Meg. Your Excellency, the Right Honorable Helen Clark, Your Excellency, Minister Daniel Gamije, and also would like to recognize all our panelists today. Danjuma Ada, President of the Alliance, Sue Wang, Chair of the Summit, Charles Gord, Director of Medicines Patent Pool, and Tenu Abafia, a new addition to Unit 8, the Deputy Executive Director of UNITAID, and of course, Meg, my own director, Excellencies, dear colleagues and friends. Welcome to all of you, and thank you for joining us today. Those here with us in Geneva and those online. I thank the World Hepatitis Alliance and its member groups for your continued leadership and partnership, and for co-organizing this summit with WHO. Hepatitis is one of the most devastating diseases on earth, but it's also one of the most preventable and treatable, with services that can be delivered easily and cheaply at the primary healthcare level. And in recent years, we have made encouraging progress. The SDG target on hepatitis B has been met, and the number of people who have received treatment for hepatitis C has increased ninefold to almost 10 million, revising the trend of increasing mortality for the first time. The development of new direct-acting antivirals has transformed hepatitis C from a chronic disease with limited treatment options to one that's curable in a matter of weeks. Expanded coverage of infant vaccination for hepatitis B will save many children from liver cancer and cirrhosis later in life. And several countries have participated in hepatitis elimination pilots, which will help WHO establish the validation process for certifying elimination. However, despite these successes, most countries are still not on track for elimination by 2030. Too many people still miss out on services to prevent or treat hepatitis, including infants in Africa who miss out on the crucial hepatitis B vaccine birth dose. Scaling up hepatitis B birth dose in routine immunization schedules is low-hanging fruit that could make a massive difference. The reasons people miss out on services for hepatitis are the same as the reasons they miss out on other health services. Accessibility and affordability because of who they are, where they live, or how much they earn. That's why WHO's new global health sector strategy sets new actions and targets to eliminate viral hepatitis by 2030 by driving new infections and deaths down to 500,000 each globally, a reduction of 90% and 65% respectively. But this is about people, not numbers. By 2030, we need to make sure that everyone at risk of hepatitis has the knowledge and tools they need to prevent it. And everyone living with hepatitis gets the care they need. Crucially, the strategy emphasizes the need for an approach grounded in primary health care and a commitment to universal health coverage. WHO remains completely committed to supporting countries to accelerate towards elimination by strengthening primary health care and more specialized care for those patients who need it. WHO is also working closely with affected countries to investigate the concerning outbreak of unexplained acute hepatitis in young children. There are few diseases that we can realistically dream of eliminating, but hepatitis is one of them. Sustained funding, relentless advocacy, and visionary political leadership will be essential for realizing that dream. Thank you once again for your continued partnership and commitment to eliminating hepatitis. I wish you all a productive summit. I thank you. And Meg, back to you. Thank you.
DG, thank you very much, DG. I think we all get inspired when we think about that hepatitis is really the infectious disease that we believe we can eliminate by 2030. We have the tools for both B and C to make it a reality. So thank you for reaffirming that. It is now my great pleasure, I believe online, we have the Right Honourable Helen Clark, the former Prime Minister of New Zealand, and the board chair of the PMNCH, the world's largest alliance for women's, children, and adolescent health and well-being. And I don't believe she needs much introduction because she is somebody who we all know and hear. And she's been a continuous advocate and strong voice around sustainable development, climate change, gender equality, women's leadership, peace, justice, and actions for the global health issues. And we know now she's taken on hepatitis and also hepatitis financing as far as we understand. So we're looking forward to her words today. Please, you have the floor, Right Honourable Helen Clark. One moment, we're not able to hear you yet. Thank you very much. We'll let you know when we can hear you on the podium.
Hello, hello, hello.
Perfect.
Greetings to Dr. Tedros and to everyone gathered for the World Hepatitis Summit, both online and in the room in Geneva. And I agreed to take part because for the Partnership for Maternal, Newborn and Child Health, which I chair, eliminating viral hepatitis is a critical priority. We focus on women, children and adolescent health, and we know how critical eliminating hepatitis is to the constituency that we serve. I should also say on a personal basis, when I was a health minister in 1989 and 90, we were very challenged in my country by hepatitis B and hepatitis C. And the goal of elimination was just a distant dream. We didn't even think it was possible. So to hear now the strong goal expressed by Dr. Tedros and others today, that we can do it. We can get rid of viral hepatitis infection. It is very, very exciting to me. And I think if we can go after this with the same zeal that the world went after smallpox elimination, that it's gone after polio, we can do this. So that, I think, is my message today. Now, the leading speaker said or reminded us that every 30 seconds, someone is dying from a hepatitis-related illness. And he asked us, do we care? Well, my answer is yes, we do. We absolutely care about that, and we care about the health inequities on which hepatitis transmission thrives. We know that people are differentially impacted. We know of the particular impact in sub-Saharan Africa, where Hep B prevalence in children is, I understand, more than 2.5 times greater than for children elsewhere. Now, of course, we've been living through close to 2.5 years now of the health crisis brought about by the COVID-19 pandemic. And it's had an adverse impact on a lot of services, including those aimed at dealing with hepatitis. WHO surveyed, in 2020, as I recall, around half of the countries surveyed reported at least partial disruption to Hep B and C diagnosis and treatment services during the pandemic. And of course, this is very distressing because these are part of the essential core of services where we need resilience of services so that they will always be delivered regardless of the crisis that we face. Clearly, this is true for arresting mother-to-child transmission at birth. We know the vaccines are highly effective, which is why WHO recommends that every infant should receive a first dose of Hep B vaccine as soon as possible after birth. We can't have that disrupted. Now, unfortunately, ensuring both access to the vaccines and having the effective cold chains for them can be very challenging in low-income settings. I understand in 2020, only 6% of newborns in Africa received timely Hep B, BD vaccination. So overcoming these challenges will be critical to the elimination strategy. There's also the issue of treatment, making available the antiviral drugs which can manage the symptoms and complications of hepatitis effectively. Of course, in the higher income countries, liver transplantation may be an option. Not so, sadly, in many places, where affordability of necessary medicines and treatments can be very challenging and health systems may be under-capacitated. Yet, and we were reminded earlier, if we put together vaccination, diagnostic tests, medicines, and full public health education campaigns, we could avert an estimated 4.5 million deaths from hepatitis in low and middle income countries by 2030. We can do this. So the question is, how do we do it? Knowing that investment in hepatitis vaccination, for example, is considered a best buy investment. For example, it's estimated that by 2035, every dollar spent on hepatitis B elimination would earn back $2.23 in the Philippines and 1.7 in Vietnam. I don't always like to put numbers on things, but sometimes numbers are what cuts through. It's a best buy investment. You will get a return from everything you do as a country to eliminate hepatitis. The estimated net economic benefit of eliminating hepatitis C globally, I understand, would be $22.7 billion a year and would prevent 2.1 million Hep C related deaths by 2030. So we know what has to be done, but we won't be able to eliminate hepatitis by 2030 off the back of weak health systems. We need stronger health systems, and we need to invest wisely in health services which target multiple diseases and can take an integrative and life course approach. So countries are urged to focus their efforts on increasing the infant vaccination coverage, beginning with timely Hep B, BD vaccination. We need to see universal screening and treatment programs implemented, and we have to have robust data to identify those most at risk, such as women who are giving birth at home, maybe unattended, and the zero-dose children. More and more, we're learning the value of self-care interventions that empower communities to have active roles in their own health and well-being. And that's very important on the hepatitis issues too. I know that WHO has set out recommendations and guidance on Hep C virus self-testing. And additionally, we see community health workers being trained to deliver key interventions, such as vaccines, through use of pre-filled syringes. The battle to eliminate hepatitis has to be a team effort with contributions and engagement across many, many stakeholders. In achieving better alignment and coordination, the multi-stakeholder partnerships, such as PMNCH, which has more than 1,300 partners around the world across 10 key constituencies, can play a role. It's true that relationships with the private sector may also help if we can draw on its capacity for innovation, for example, on the cold chain solutions, and providing the technology and expertise that's needed to deliver much needed vaccines, such as for Hep C. The current pandemic experience has shown us just how critical it is to build resilience into the delivery of health services, including those for women, children, and adolescents. Their needs have to be prioritised as we move forward with current recovery and for future preparedness. And at PMNCH, we see the proposed new WHO International Instrument on Pandemic Preparedness and Response as a unique opportunity to make this happen, and for it to explicitly prioritise sexual, reproductive, maternal, newborn, child and adolescent health services, including for hepatitis screening and protection everywhere. We have the solutions for ending viral hepatitis in our hands. What we need is prioritisation by national governments and development partners. I know that the Hepatitis Fund will hold a pledging event in November this year, and it aims to double investment in viral hepatitis elimination. From PMNCH, we pledge our full support to that effort. We know that working together, we can all achieve making viral hepatitis history. Thank you very much and have a great conference.
Very much, Right Honourable. We really are inspired by your comments, especially around the best buys, and that this is absolutely within our reach, and that countries can prioritize this and have a return on their investment. So we appreciate your really wise comments and taking it also and ensuring that we're not letting women and children and adolescents behind in our efforts to also eliminate hepatitis B and C. So thank you. It is now my pleasure to introduce Dr. Daniel Njamije as the Minister of Health of Rwanda, who is standing in as the delegate for Her Excellence, the First Lady of Rwanda. So I believe he should be online with us now to be able to share his comments and opening remarks. Thank you. Over to you, Excellency, Minister.
Thank you, moderator. Dr. Tedros, Director General of the World Health Organization, representative of government, distinguished guests, ladies and gentlemen, good afternoon. I'm honored to deliver this opening message on behalf of Her Excellency, the First Lady of Rwanda, Ms. Jeannette Kagame. The fight against viral hepatitis is a global health priority that must not be met with apathy. Viral hepatitis is still an epidemic across the world. However, it strikes as a particularly cruel in the global south, where it is exacerbated by compromised access to healthcare and poor living conditions. But quite frankly, it is due time, honorable guests, that we refuse to allow factors such as economic power of our nations or individual consumer power of our citizens to dictate the value of our lives. It is due time that we revoke the notion that wealth, skin color, geographical origin, or political history should determine whether our death or suffering at the hand of disease should cause alarm. Indeed, this notion ought to evoke dark but distant times of the past. I believe that we can all agree on this: the eradication of viral diseases and the defense of well-being of all humans. Ladies and gentlemen, though powered by science, is not a scientific issue. Access to healthcare is a moral issue. It would seem irresponsible to ignore the reality that of 300 million people across the world living with hepatitis B, the vast majority of the sufferers are in Africa. No, the alarming number of the people infected with viral hepatitis is not just another statistic that speaks of some unavoidable misery in the less financially prosperous countries. It is a slow burning tragedy. Ladies and gentlemen, I wish to reiterate this on behalf of the First Lady of Rwanda, and I believe every Rwandan citizen. eliminating hepatitis, particularly hepatitis B and C, is a moral issue. Thank you, Dr. Tedros and the World Health Organization for the resolve and integrity you show yearly in demanding that the world should stop for an instant to reflect on the journey we must brave collectively if we are to stop the ravages of viral hepatitis by 2030. Thank you once again for turning every stone, for leaving no corners unattended when it comes to health concerns that can and have devastated families most in need of protection across the world. Ladies and gentlemen, allow me to make the case for collective common action against viral epidemics from the perspective of a green-haired, landlocked country in East Africa that is determined not just to survive, but to thrive. The rippling damage in 1994 and instability, conflict, and mass displacement encountered by Rwanda prior to that began to show their teeth shortly after our liberation. It rolled at us in a very sick children cries. It lacked in every life that seemed saved by peace, only to become poisoned by sicknesses. But we could not afford to be discouraged. From Vision 2020 to our 2030 Sustainable Development Goals, we have been committed and pledged to remain devoted to the eradication of preventable ailments. The elimination of affliction in particular has proven itself challenging despite our continuous efforts. Viral hepatitis, the killer of over 1 million people a year, has been tough to eradicate. I say tough, ladies and gentlemen, but not impossible. In December 2018, Rwanda launched the Hepatitis Elimination Plan. Since then, 6,500,000 Rwandans have been screened for hepatitis C. We believe that this encouraging number can, within foreseeable future, rise to entire population. And still, dear guests, however uplifting this feat might be, it remained insufficient. Rwanda was one of the 6 countries to step up and participate in the global pilot to assess the feasibility of the validation criteria for hepatitis elimination from 2021-2022. The conclusion of this assessment is one of you are familiar with. Honorable guests, it must be repeated tirelessly. Nonetheless, the elimination of virus hepatitis will require us to tick 4 boxes. The first is community awareness. One cannot protect themselves against an enemy whose existence is unknown. One cannot seek treatment or preventive guidance for a disease they are not meticulously informed about. The second box to tick is mass screening. Though we tend to use the word mass, I hope that I speak for fellow Rwandans when I say that the desirable goal here is to replace mass with absolute. Why should we not be able to screen every single one of our citizens? The third box here, dear guests, dear friends, is optimizing precision. Testing as many people potentially infected with hepatitis as possible. And the last box that must be attended to is offering treatment. The appropriate and attentive treatment of every Rwandan infected with hepatitis should be warranted. I speak to you from the heart, ladies and gentlemen, and when I assure you that we live to see the number of people infected with viral hepatitis in Rwanda sink to nilness. As Dr. Tedros has inspiringly taught us, no stone indeed should be left unturned. Cross-sector partnership and transnational partnerships will take us to hepatitis-free 2030. I call upon those who have followed our track record and felt the determination behind the encouraging numbers reported by the World Bank and the World Health Organization and plenty of other global data-driven institutions for improved social welfare. Numbers attesting our progress in the health sector. I call to those that understand what this progress took to trust that we will do this. The elimination of hepatitis is a moral issue. I hope, ladies and gentlemen, that today, as it is patent to hepatitis B, we can commit to bearing the unwavering moral core that we must rely on to fulfill our collective duty. I wish you a persuasive, instructive, and impactful World Hepatitis Summit, and I thank you for your attention. Thank you.
Thank you very much, Honorable Minister, for your wise words and for your 4 points and steps towards elimination in Rwanda. We know already in the room there have been countries and other partners who have been really inspired by the work that has been done, and we know that that it will be a success and you will be able to eliminate viral hepatitis by 2030. So thank you very much. It's now my great pleasure to be able to introduce the Professor Khaled Abdel Ghafa, who is the Acting Minister of Health and Population of Egypt. And he will be making his presentation as well virtually. So thank you very much. And we know Egypt has been the leader in hepatitis elimination. And so we'd love to hear from our Minister of Health of Egypt. Thank you.
Your Excellency, Dr. Tedros Adhanom, Director General of the World Health Organization, esteemed and distinguished colleagues, it is indeed a privilege to join you today at the 3rd World Hepatitis Summit at a critical time of our planet. I would like to cordially congratulate Dr. Tedros for his befitting re-election to a second 5-year term, leading the multilateral champion of the past couple of years, the WHO. His leadership has proven to be an integral factor in the success of the multilateral efforts to combat this pandemic. His continuous and robust calls for equitable access to vaccination, PPEs, and diagnostics have been nothing but admirable. I wish him continued success in his second term and my best wishes to help steer the multilateral ship and overcome the present and future health challenges. In Egypt, we witnessed a scene that once seemed impossible, where we were able to diagnose almost 2.2 million Egyptians and non-Egyptians with chronic HCV after screening over 60 million people over the age of 12. We formulated strong partnership with international organizations, stakeholders, global funders, and a pharmaceutical industry. Our focal point is the prevention of new cases, the diagnosis of current cases, and the treatment of all patients. Along our journey to fulfill our national goal of eliminating HCV and adopting the WHO Global Health Sector Strategy to eliminate viral hepatitis by 2030. We achieved many milestones. We successfully built a strong network of viral hepatitis treatment centers with robust diagnostic capacities and a well-trained workforce. Moreover, we succeeded in attaining direct-acting antiviral drugs with only 1% of their global price, translating that into a local production of millions of generic antiviral medicines with affordable prices as low as $40 for the entire treatment regimen, allowing us to provide the treatment for nearly 4 million patients between 2014 and 2019. All these efforts were accentuated by the unprecedented nationwide presidential campaign 100 Million Healthy Lives in 2018. Furthermore, the Egyptian government adopted a strategic cabinet decree mandating the use of safety syringes and strictly following the WHO guidelines to ensure blood safety. Currently, we are witnessing for the first time in Egypt the launch of opioids substitution therapy. Egypt is also committed to maintaining its national response against hepatitis at the highest level, ensuring the sustainability of the achieved targets. And today we are making history by reaffirming our pledge made by His Excellency President Abdel Fattah al-Sisi to treat 1 million fellow Africans from this deadly disease. As it has always been, Egypt saves no effort to assist its brothers and sisters across our continent and around the globe. To further our cooperation, we have already supported many treatment centers in 5 African countries with diagnostic tools, medications, as well as capacity building and know-how transfer to help those nations to adopt their own tailored protocols of response according to their specific needs and requirements. From our global obligations and belief that universal health coverage can only be achieved collectively and through continued bilateral and multilateral cooperation, Egypt is expanding collaboration and partnership with many of our partners globally to reach as many countries as possible. It is worth mentioning that Egyptian leadership believes that the locomotive of development is securing health care for all the people, especially those mostly in need. To this end, the Egyptian policy prioritizes the health sector, aiming to relieve and facilitates healthcare services. Those services have been offered to Egyptians and all Egypt residents alike and have been extended to our brothers and sisters in all African countries and our friends and partners around the world. Egypt was once regarded as a country with the highest HCV prevalence worldwide, where the Egyptian demographic and health surveys measured antibody prevalence among the adult population aged from 15 to 59 years at 14.7% in 2008. Today, I'm proud and honored to announce that Egypt successfully submitted its HCV elimination dossier to the WHO in June 2021 to be the first country aiming for the declaration of elimination. We will continue to work together, hand in hand and inclusively, on fulfilling the UN 2030 agenda and achieving good health and well-being for all people. We will keep on sharing our insights, expertise, best practice, and what we have reached so far in combating viral hepatitis, allowing us all to achieve our common global goal, collectively as a united people of the world. With the help of our partners, their engagement and sponsorship, we will be able to achieve that was once deemed impossible. We will be one step closer to our goal by investing in research, both public and private, and by welcoming the innovation of civil society actors and private sectors and development partners. Finally, I wish you all fruitful deliberation with tangible outcome, because there can be no justice without reaching every individual with appropriate health care. I thank you all for your attention.
Thank you very much. And those numbers are astounding, and I think they inspire us all to what can be done when there's leadership at the highest level. So thank you very much to Egypt and to his honorable minister. Now I'd like to pass back to Sue.
Right, so I'm going to now, it's my pleasure to bring up Dr. Tanu Avafia, who is the Deputy Executive Director of UNITAID. Before joining UNITAID, he served as the head of the Resident Coordinator Office in Zimbabwe, and in that role, he supported the coordination of the UN country team. He has extensive experience across human rights, public health, health systems, and equitable access matters, and we look forward to hearing about the work of UNITAID in hepatitis.
Thank you very much, Madam Co-Moderator, Director General, Dr. Tedros, the Right Honorable Helen Clark, Honorable Daniel Ngaminje, Honorable Khalid Ghaffar, Excellencies, colleagues and friends, as we say back home, all protocol observed. I'd like to start my brief remarks this afternoon by thanking the organizers, the World Hepatitis Alliance and the WHO, for their leadership in keeping a spotlight on a health priority that is not only critically important to us at UNITAID, but one that we think presents one of the best opportunities we have to make meaningful progress on the 2030 Agenda for Sustainable Development and SDG 3. I speak of meaningful progress because, as we've heard, unlike many other health challenges we face today, it is totally possible and plausible to eliminate viral hepatitis, as WHO and many others here today have called for. And that's because, unlike many other communicable and non-communicable diseases and conditions that require long-term, if not lifelong, management, we actually have the tools, we have the technologies to eliminate viral hepatitis, especially hepatitis C. Lest we forget how much has changed in the last 10 years. As recently back as a decade ago, treatment for HCV used to be extremely difficult. Medicines were limited in their effectiveness. They were prohibitively expensive. And the side effects sometimes were so severe that many patients elected to not complete their treatment courses, often with tragic personal consequences. As we've heard, thanks to direct-acting antivirals, we have seen a medical sea change, the likes of which is rarely seen in modern medicine. Today's treatments are safe, simple to administer, extremely effective, and affordable, as we've heard. In many, and I say many, not all, but in many low and middle-income countries, the cost of a cure can amount to less than $100 per person. As we know, effective disease responses require not just affordable treatment, but also tests that can be accessed easily and that help to diagnose hepatitis C quickly and accurately. And here too, the news is good. We now have a robust set of tools to diagnose HCV, and the latest generation of tests can be used at or near point of care. Now, Unitaid realized the potential of new treatments early on, and we became committed to ensuring that people in low and middle-income countries have access to a cure for HCV. First, we partnered with Médecins Sans Frontières in 2015 to 2017 in an initiative in India and in Cambodia that demonstrated that it was absolutely possible to manage HCV treatment in so-called resource-limited settings. In some ways, this was a replication of the famous Khayelitsha study, which did the same thing for HIV some 20 years earlier. We then partnered with FIND in a project in India, Malaysia, and Myanmar that demonstrated that it is feasible to integrate HCV testing and treatment into other government programs, such as those that provide antiretroviral therapy, or harm reduction programs, or indeed general health services. We also continue to support work on developing better and simpler and more effective tests, including HCV self-tests. And in parallel, we work closely with several partners in the room and online who are raising awareness with government officials and with key populations and communities about the fact that it is now simple and straightforward to test and treat HCV. We've learned a few lessons along the way, and I'd like to share 3 of them with you in wrapping up my comments. The first lesson is that the simplification of HCV testing and treatment is critical to successfully integrating HCV programs into existing health facilities, such as antiretroviral clinics. In the absence of very well-resourced viral hepatitis programs, integration could be a starting point for many countries. The second lesson we've learned comes from our responses to HIV and to COVID-19, which have shown us that in many settings, it is extremely valuable to have self-testing. And that, as we've seen in HIV, we're seeing in HCV that sometimes there are extremely high levels of stigma and discrimination. And it is important that we continue to invest and generate a robust pipeline of self-test to strengthen our responses. Work is also ongoing for a long-acting cure. Now, these would be tools that can simplify things further in certain settings and for certain hard-to-reach populations. But in the meantime, we also think that it's essential to use the existing tools we have now, today, especially for those hard-to-reach populations. The third and final lesson I'd like to share this afternoon from our learning was that regardless of where one starts from, it is possible to make a difference. At Unitaid, we started working on HCV very incrementally, and that's because HIV was the core focus area for us at the time. And so the initial work focused on the intersection between HCV and HIV co-infection. As we learned more and we realized what types of gains were possible in HCV, we gradually expanded our work. And we're sharing our experience today because it may be an approach that some may wish to consider. Because if for a variety of reasons it's not possible to launch a large-scale, ambitious program, the likes of which we've heard of in Egypt or in Georgia, then there are some low-hanging fruit where one could add value to existing programs as a starting point. So let me end my comments this afternoon by once again affirming our commitment at Unitaid to continue working with WHO, with WHA, with the partners in the room and also online. Our collective response to HCV has the potential to be a success story for disease elimination. We look forward to learning how we can continue to support this important effort. And I also join previous speakers in wishing you a successful and an enlightening summit. Thank you very much for your attention.
Thank you, Dr. Avafia. Appreciate your comments, and we look forward to collaborating more with Unitaid in viral hepatitis elimination. So next, I want to bring up Charles Gore, who is the Executive Director of the Medicine Patent Pool, but previously of the World Hepatitis Alliance, so we will always claim you. You can never leave us, and the connection is always there. But I want to ask you a question, Charles. Thank you for being here. What can you tell us about the role of the affected community in the hepatitis response? And maybe you can share a little history about that with us. Thank you.
Sure, thank you very much indeed, Sue, and thank you very much for the invitation. I'm not going to stand up and read some kind of prepared speech. I mean, I've always personally felt that the affected community are critical to any response. And way back, more than 20 years ago, when I was diagnosed with hepatitis C and cirrhosis, and I couldn't find any kind of support in the UK, I set up an NGO, the Hepatitis C Trust, that Rachel, who's sitting in the back now, runs, really for that purpose, for people living with hepatitis C to support other people with hepatitis C. And actually, Rachel's done a fantastic job in growing that, and it's now an organization with, I think, more than 120 people, and almost every single one is a peer worker in one form or another, really showing the importance of the affected community. And when, way back in, I guess, 2010, just before the World Health Assembly, at which the very first resolution on viral hepatitis was going to be debated, I went up to get my badge at WHO headquarters across the road here, and they were just polishing up. How long have I got? Okay. They were just polishing up the statue commemorating 30 years since the eradication of smallpox. And I looked at that and I thought, we've got Hep B vaccination. We're just beginning to get the Hep C drugs. Okay, eradication is probably beyond us, but elimination, surely we could do that. And it was that statue that really inspired me. And I thought, yeah, this is what we've got to push for. And this idea of a summit to try and move this agenda on came from this idea of trying to get the affected community and governments together with public health organizations, and particularly WHO, together in a room to really understand how we could move this. And actually, I should just say thank you to WHO, because I think at Dr. Mingwei's prompting, at the second World Hepatitis Summit in 2017, just as I was stepping down as president of the World Hepatitis Alliance, the HIV and STI and hepatitis department gave me a present. I was really incredibly flattered to be given a present by WHO. Only the thing was, it was a hammock, and which kind of had a message, I thought, in it, which I wasn't sure I was quite ready to hear at the time. And in fact, my hammock has been largely unused, and I'm keeping it till the moment when actually, yes, we've got to elimination, and maybe I can relax in it. But, you know, there's a lot to do. And I want to sort of end by saying that right from the beginning, I've always felt that viral hepatitis was this neglected child in public health. And I really couldn't understand it. And that was certainly the case back in 2007 when we started this. And it was like so neglected, and yet its siblings, HIV, TB, and malaria, were very well looked after. They got presents every year. And somehow, viral hepatitis always seemed to be living in rags. And what has happened, which is great, is that it's got a lot more attention now. It's not neglected the way it was. And that is largely because of WHO really taking this on. And Dr. Tedros's leadership, but also Meg's leadership in the department, has really, really pushed this. And right at the beginning of the World Hepatitis Alliance, I decided we have to do this with WHO. WHO are the public health organization, and we want leadership from them. I have to say, prior to Dr. Tedros's terms, leadership was a little bit on the lacking side sometimes. And that's all changed, and that's great. But, I still think that hepatitis is dressed somewhat in rags. We're beginning to get some hand-me-downs from our better-off siblings, because this is what we should be talking about, the integration. But we still need some catalytic funding. And the Hepatitis Fund is really helping in that regard, so is Unitaid, but we need more of this. It's not, we don't want another global fund or anything like that. That's not the way that public health is going. It's about countries taking this on. But sometimes countries need some help to start with. And if anything comes out of this summit, I would really like some people thinking about how we could finance this, not in vast billions and billions of dollars, but in really smart, clever investments. So thank you very much.
Excellent. Fantastic.
Thank you, Charles. I really want to thank you for your leadership, your vision, your inspiration, and your mentorship to so many of us. So now I actually want to close the high-level panel. Thank the audience again. If you could give them another round of applause. I mean the speakers. Thank the audience. Thank the speakers and the audience, online and virtual, for being here. I will ask you all, you can take your seats, and I'm going to bring Danjuma back up one last time. We have a special video to share with everybody.
The doctor told me that, look, you have hepatitis B, so you cannot go overseas. No one at all from my village had that opportunity to go overseas for study. And for sure, my parents would not be able to afford any of that. So having a scholarship to study overseas is actually a really big deal for someone from a village in the north of Vietnam. And I was lucky enough to secure a scholarship to study in Europe. And as a part of the paperwork, I have to go through a health check. And hepatitis B test is among the health check. So when I came to get the result, the doctor told me that, look, you have hepatitis B, so you cannot go overseas. and then I had to reject the scholarship just because he told me so. I don't know why, like by that time I didn't challenge him or explore more, like whether what he said was correct. But look, as a first year university student and you had no experience in life, and then you tend to trust everyone that deemed to be more superior than you, like the doctor in the hospital.